Hi all, in this video I will tell you the normal lung versus a asthmatic lung. Okay, so in this picture we can see we have two lungs, okay, and the trachea, bronchus, bronchioles, alveoli. These are the structures involved in the lower respiratory tract. When a person is allergic to any dust or pollen or any particular pathogen, what happens? We the antigen will enter into the respiratory tract through the airway, okay, and it will cause some inflammation in the bronchus, which can cause in excessive production of the mucus and the bronchial smooth muscle. We can see the muscles which covers the bronchus there. Because of this bronchospasm, the muscle will get tightened. We can see in the picture, the first picture shows the normal bronchus or normal airway. Second, we can see an asthmatic airway. Okay, that means there is a narrowing of the airway because of the tightened muscle, because of the swollen and tight bronchioles, as well as there is an excessive production of the mucus because of the inflammatory changes in the bronchus. That means the space to travel the air is getting limited in case of asthmatic airway as compared with the normal airway. In the normal airway, we can see the normal muscle and there is open airway. But here in asthmatic airway, we can see bronchospasm, tightening of the smooth muscle, as well as there is excessive accumulation of the mucus. So what happened when this happened? Because of the excessive accumulation of the mucus, there is wheezing can occur. That means on auscultation we can see the audible wheezing, and because of the bronchospasm, the client will get shortness of breath and coughing. Because of this mucus will trap the airway, it will irritate the airway, and the client will experience coughing because the client will try to expectorate or cough out the sputum. That means the productive cough can be noted in case of bronchial asthma. And also there is chest tightness because the smooth muscles will get tightened and the client experience chest pain or chest tightness. Okay, so these are the symptoms involved in the bronchial asthma, and we need to manage all these symptoms. We need to manage the bronchospasm. We can administer bronchodilator, and to expel out the excessive secretions, we can administer expectorants for a productive cough. And for the chest tightness or chest pain, we can administer analgesics. We can administer this corticosteroids for the inflammatory relief from the inflammatory changes. Okay, all these are the management. In addition, we need to correct the hypoxia because of this narrowed airway. The gaseous exchange will get impaired, so there is an ineffective airway clearance occurs. So the client oxygen saturation level will get decreased, that means less than 92%. So we need to correct the hypoxia. Okay, these are the main management and the main symptomatic management involved in the bronchial asthma. So next video I will add up with the question analysis. So just watch it with this NCLEX focus bronchial asthma. It is a nutshell theory only, it is not a detailed explanation. Just you want to differentiate what happened in a bronchial asthmatic lung airway and travel as well as in the normal airway. Because in normal airway there is no obstruction to the air to pass through the airway, but in case of asthmatic airway there is a bronchospasm, tightening of the smooth muscle and excessive accumulation of the mucus which will obstruct the airway. So the client will experience hypoxia, bronchospasm. Okay, so hope you got a clarity on that. If you have any doubt on this question analysis, and if you want to join for our class, if you want to know more about the class details, you can contact us. Thank you.